My name is Rebecca Delafield. The title of my presentation is Assessing Maternity Care for Native Hawaiian and Pacific Islanders. Native Hawaiian and Pacific Islanders have the highest rates of late or no prenatal care compared to all other racial groups in the United States. This is a concern because research indicates that this group has higher rates of diabetes and hypertension, conditions that can increase the risk of adverse pregnancy outcomes. Early prenatal care screenings can help identify and mitigate those risks. Native Hawaiian and Pacific Islander groups hold distinct cultural perspectives on health and wellness and face barriers to maternity care that include challenges with provider communication and discrimination. The objective of this study is to culturally adapt and pilot test a measure that assesses the quality of Native Hawaiian and Pacific Islander women's interactions with healthcare providers. To meet this objective, data was gathered using semi-structured key informant interviews in English by an online meeting platform with Native Hawaiian and Pacific Islander women less than 2 years postpartum. Data will be analyzed to ascertain perceptions of maternity care, priorities, and women's impressions on the Mothers on Respect Index, a measure that evaluates a patient's comfort, behaviors, and perceived discrimination in the context of the patient-provider interaction. Next, data from interviews, expert reviews, and cognitive interviews with NHPI women will inform the adaptation of the Mothers on Respect Index. Finally, the culturally adapted measure will be piloted in a sample of Native Hawaiian and Pacific Islander women who have delivered a baby in Hawaii within the past 3 years. The qualitative data collection for this study is ongoing. To date, 22 participants have been interviewed. They have a mean age of 29 years old. Nearly half are Native Hawaiian, and about a third are Chukis, another Pacific Islander group. 50% are on Medicaid, and 25% of the women were first-time mothers. 75% of the women interviewed delivered during the coronavirus pandemic. Preliminary analysis indicates that participants expressed support for the original topics covered by the Mothers on Respect Index. However, they recommend amendments that reflect a broader context of care and cultural perceptions and also allow for narrative responses. Based on early results, our data suggests that adaptations to the Mothers on Respect Index could improve its relevance for Native Hawaiian and Pacific Islander women. A pilot study will provide details on the validity and reliability of the adapted measure.